Hi, I'm Sara with Croatians Online, and today I have a very special guest who is coming to me from the Boston area in the United States of America. I have Dr. Alen Juginovic, a medical doctor and postdoc at Harvard Medical School, Department of Neurobiology. I'm hoping I'm getting that correct. And he talks a lot and works a lot on sleep medicine, communicating science to the general public. We're going to talk a lot about that. And there's just so much I could say about your work, Dr. Juginovic, but you're going to share a lot of that with us today. So thank you for being here with us on today's episode. We really appreciate you taking your time.
Yes, Sarah, thank you so much. It's great being here, and thank you so much for inviting me.
Yeah, wonderful. So, since this is Croatians Online, we are always curious about how people end up where they end up. So,
Oh,
you are
yeah,
from Croatia. So, if you can share
correct.
your journey from Croatia to Harvard, how did that
Sure,
happen?
sure. I like to start off this. I could never imagine being here. So that's the first thing, and it is it is somewhat surreal. Not really somewhat, but it is pretty surreal. Especially, sometimes when I come out of classes, I teach here at college, and sometimes I come out of classes, and then I'm like, and was this me who was teaching this class, just
Mhm.
5 minutes ago? It's surreal because it's an amazing, amazing place as everybody knows. But yeah, to my story, back to my story. So born and raised in Split, Croatia, on the coast,
Oh,
beautiful
beautiful.
city,
Hmm.
love the city. Do lots of work with medical students there and other people there because I just enjoy the city. It's amazing. I finished my medical school there in 2018, maybe 17, maybe 19, but let's say 2018 more or less. And then worked for a brief time in the hospital in Split. And then in 20, I think late 2018 or 2019, I started working in Zagreb in a private hospital. It's a great hospital. It's called St. Catherine Hospital. Had an amazing experience there in the field of personalized medicine. So basically, what personalized medicine is, for people who are not familiar with it, is we would administer based on genomics the right drug at the right dose for the right patient at the right time. So it's really individualized, personalized medicine. And I'm sure it's one of the things that's the next kind of step in medicine, especially in some fields of medicine, such as psychiatry or neurology or even sleep medicine, which we can talk about. But
Hmm.
back to the story. So and then in 2019, so I started working, let's say late 2018 in St. Catherine. In 2019, one of the professors that we invited here into Croatia to speak at one of our conferences invited me to come to the US, to Houston, Texas, to do an internship, kind of rotate, basically internship observership program. Amazing person. I highly respect that person. He was the head of neuro-oncology. So unfortunately, brain tumors and
Hmm.
tumors of the nervous system. And as you can imagine, patients with those tumors carry a severe burden. And I was with him for a couple of weeks there, and it was an amazing experience just to see how Houston and the hospital works. The hospital is called MD Anderson Cancer Center, so one of the leading hospitals in terms of cancer research and cancer treatments in the U.S. and in the world. And then probably the most interesting part of the story is I had a week off in between the end of the internship and me going back to Zagreb, Croatia. And during that week, and I don't know why, you can ask me, why did you do what I'm going to say I did? I don't know. I guess it's just me. I said, since I'm already in the US, why not just visit the best universities in the world? Stanford,
Oh
MIT,
yeah,
Harvard, since I'm already here,
that's a
like
great idea.
America's,
Yes. Hmm.
right? And can you believe it? I emailed one person from each university in the field of neuroscience. So Stanford, Harvard, MIT. I emailed them two-sentence email. Hi, my name is Alan. I'm a doctor from Croatia. I would like to visit your lab just to see what you guys do there. What's so special, about Stanford? You hear about Stanford, Harvard, those universities, but you can't really feel what's really so special. I mean, apart from the infrastructure and all of that stuff. And to my shock, not even surprise, all of them said, "Yeah, just come to our lab whenever you want, whenever you can." And I was like, okay, this is pretty cool. And probably I don't even want to say how much money I had in the bank, but very little. So very little. I probably spent the last dollar, and I'm not even exaggerating, on those tickets from Houston to San Francisco to see
Wow.
Stanford. I spent a day there. Slept in a very cheap hostel, but that's
It's
life.
okay. Yeah.
And then
Hmm.
the next day I went to Boston, across the country to Harvard, and this is where the kind of magic, I guess happened. I came to Harvard, visited the lab for a total of 3 hours, maybe 4 hours, and I spoke to the person who's head of the lab, professor who's head of the lab, for maybe 2 hours. And before I even saw the lab, I spoke to her for 2 hours, and she was like, "Tell me your CV. What are you doing in Croatia? All of that stuff, right? Basically, what
Yeah.
I'm doing here now." And after those 2 hours talking about my work in Croatia, what I think of their work here at Harvard in terms of sleep, some data, and all of that, I visited the lab, the actual lab, met the people, talked to them very, very briefly, went back to her office, and then she said, "Well, why don't you come work for us?" And I was like, "What do you mean? Why didn't you come work for you here?" And she was like, "I'm dead serious. I would like you to stay here and work." And as you can imagine, coming from Split, Croatia, which is not the biggest city in the world, especially maybe in terms of science, it's big in terms of heart and spirit, passion, but not maybe in terms of science or medicine. And coming from there to Boston and being offered a job at one of the leading med schools in the world is surreal. It's
Wow.
almost there was a news article. I'm going to finish with this. It was a great title. It was um, something along the lines of, "His reality is better than his dreams," and this is really true. You could never dream of coming here, and I could never dream of even being here
Hmm.
now. And now I'm here and talking to you. So
That's
that's my story.
beautiful. That's an amazing story. And I think that it
Yeah,
speaks so much to um like the motivation, like, like you
yeah,
cared about this, you wanted to learn, experience, so you put yourself out there. And I think that, you and I talked before we came here about how, I work with younger people as well. Younger people, I think, are hesitant at times to like put themselves
yeah.
out there and do things like that. But I think your story is so important for young people to hear, that sometimes you have to kind of give it a shot and see what happens,
Yeah,
because you don't know what could be and what could be in store for you. And that's
yeah,
amazing that
absolutely.
you did that.
Absolutely. I mean, I think that one of the main messages for all young people, I don't consider myself old, but for all young people or
Hmm.
those who feel young at heart,
Yes,
I
yes.
really feel like being proactive, taking action, taking the first step and not waiting for somebody else to take you to that first step is crucial. And just I always think of this, and it might be philosophical, but down the road, 20, 30, 50 years from now, life comes to an end. And I don't want to be the person who regrets a lot of things. Why didn't I do that? Why didn't I do this? For $100, I didn't buy a plane ticket,
That's
right?
amazing.
That would be crazy. So and you can never, you just never know, or almost never know, what little things could change your life. And when I say little things, I mean, I was driving the professor who invited me to Houston from our conference to the airport by accident. Other people also drove other speakers to the airport. I was driving him. And in that 20-minute ride, from Split, or 25-minute ride from Split to the Split airport, he asked me in 30 seconds, "Why don't you come? You're a cool guy,
Wow.
active person. I want you to see Houston and what we do there." And I'm incredibly grateful to that person, not only because he invited me, of course, that's the major part, but he was so kind. He and his wife were so kind to have me at their home. I slept at their home, because sleeping for a month or slightly less than a month in Houston for me at that time was expensive.
Right.
And
Hmm.
he was incredibly kind to, basically, I was almost his child. He treated me
It's
almost like his
beautiful.
child there, and it's amazing. And I respect that person immensely. And now he's
That's great.
the head of neuro-oncology at UCSF San
Oh,
Francisco.
wow. In
Amazing
San
person.
Francisco. That's
So
great. Wow.
yeah,
So, yeah. So I think that and I'm so glad that you're sharing, because I really do think that's such an important takeaway,
yeah,
is that our journeys are going to be, feel a little bumpy, a little scary, a little all of that.
absolutely.
But like, if we put ourselves out there and we really, try, we could meet people who end up showing us
Absolutely.
a way that we never knew. So I love that. I love that.
You never know. You never know.
Yeah, that's amazing. And so now you're here, which is great, and we're very happy you
Hmm.
are too. I'm also curious, and I think a lot of people listening are curious, why
Hmm.
neuroscience, sleep medicine? What about that really
Sure.
drew you in?
Sure. So in med school in Croatia, one of the professors who I also respect a lot invited me to become a student assistant at the neuroscience department in Split, Croatia. And she invited me literally in the hallway. It was very informal. Hey, do you want to be a student assistant next year? And I was like, let me think about it for the for the week over the weekend. And I said yes. It was obviously in hindsight one of the more crucial decisions because you never know where that if I didn't say yes, where that could
Right.
have led me. But I said yes, and I started basically teaching students neuroscience, but primarily neuroscience of sleep at the University of Split School of Medicine there as a student assistant. And I started liking that while I was a student there. When I took the neuroscience course, it intrigued me because you sleep a third of your life, and I can ask two extremely simple questions, and nobody has a true answer, and that is why do we sleep? What's the main point of sleep? I
Mm.
understand we can all say, to reduce neurological, disorders. I get all of that, but what's the main purpose of, we know what's the main purpose of the heart, of, the liver or whatever, one of them. But what's the main purpose of sleep? It seems like there are so many, and yet we can't find, at least we think we can't find the exact, main purpose of sleep as of yet. And the second question is, why do we sleep 7, 8, 9 hours? Why not 3? Why not 23? Why do elephants in the wild sleep 3 hours, or giraffes
Yes.
sleep 2 or 3 hours? Cats sleep, 15 plus hours.
Hmm.
But and you might say, well, it depends on the size of the animal. Well, cats are tiny compared to animals, yet the difference in sleep is massive, right? And we don't know why we sleep 7 hours or 8 hours. And that's another fascinating enigma. And we know what happens when you sleep poorly, right? And we know what happens when you oversleep as well. But we don't know the main purpose of sleep, and we don't know why we sleep the number of hours we sleep. And that intrigued me a lot. And I started getting even more intrigued when I started teaching students there in Split, and then I started volunteering in the sleep clinic. All of that stuff, kind of exploring the field even more, going to conferences, meeting cool people from the sleep field, and then in the end, I kind of decided, okay, it seems as though this could be the field I actually want to pursue. Since when you're a medical student, it's very difficult to say, oh, I want to do only neurosurgery and that's it, right? I feel like many medical students don't know what they're going to do. And I kind of said, okay, let's try, positioning myself in this field, which some might say is niche. Even though sleep is incredibly important, we sleep a third of our lives, but sleep medicine is not when you think of medicine, I don't think sleep medicine is the first field of medicine that you think. So that's why I call it niche, although incredibly important. So I started getting interested at med school, teaching students, and then it just took it, I guess, on from there.
Wow. Wow. And it's interesting because you're right about the fact that I think that it is niche in the way that I know someone like me who is not
Yeah,
at all in the medical field doesn't think about it that much, right?
yeah,
But like you said, there's so much to it and there's so much that can be impactful to the body about it, and that we have to really be paying attention to the
yeah,
whys and the hows and all of that. And so that work is so really important and vital, I think, out there too.
yeah.
Um, some interesting things that I would love you to share a
Hmm.
little bit about that I think our listeners would also love to hear is you I know do a lot of attending conferences and you're out
Hmm.
there, really sharing your work to people, including athletes and things like that. And I
Hmm.
know you recently were at something for the NBA, which is a very popular
Hmm.
organization in sports
It
here
is.
in the US. And so what about that could you share about like that's important, like for athletes, for
Sure,
the work that you're doing, really going out there
sure,
and doing these
sure.
conferences? Why basically, I guess, is that
Sure.
important?
Uh, the quickest answer as to why I do it, because it's fun and I love it.
Okay, I love
And
that.
it's it's kind of I do have that mentality: one life, use it or it's just gone. And so I think we spoke about this the last time we spoke, or before this.
Mhm.
I said, somebody said, I don't know who said, to retire is to expire,
Yep.
and I don't want to be in that. I really believe directionally that that's correct, and I don't want to retire ever. When I don't know what's I don't even consider myself working now. It's all part of this really fascinating thing that's called life, right? I mean, this is all philosophical now, but I just enjoy it. Of course, to people listening or watching this, some days some days in the week, in the month, are also frustrating for me. It's not like I'm enjoying myself and everything's perfect, living in an amazing world. Of course, the world has problems, and
Mhm.
we all face challenges and issues, but fundamentally, when you go to sleep, when you go to bed, I feel calm knowing that I love what I'm doing now. And just to answer the question about athletes and stuff, for athletes, elite athletes, really, in Olympics,
Yes,
are
big
ongoing
right
now in
now.
Paris,
Mhm.
and it's incredibly important for these athletes, because it's to sleep. Chronic quality sleep is crucial for them. Long-term quality. Why? It impacts obviously their cognitive performance. So people who sleep poorly, athletes who sleep poor, are not going to be as concentrated, are not going to be as focused, won't have enough energy. All of the usual stuff which we all know. But yet, you would be surprised how few athletes have, or teams have, a dedicated person for sleep. It's not like
So
they obviously have
interesting.
a. It's fascinating, really. I mean, I've been in touch with many teams, and very few of them have a person dedicated to sleep. And I'm not saying everybody should employ a person, but at least maybe the doctor or somebody needs to, go on a year-long course or something to really profoundly understand how sleep affects athlete performance beyond the usual, lack of energy, focus, all that stuff. That's all great, but how do we fix it? Is what's really, really important. And you might say, well, they just need to sleep. Oh, that's a quick fix. But what if I told you that some teams travel every other day and they just cannot get 8 hours of sleep? What do you
That's
do
such a
then?
good point.
Right?
Right.
And we I mean, collaborating with the NBA, amazing people. Again, really respect all of those people there, and been super fortunate to be at the conference you were mentioning, where I was talking basically to doctors from all NBA teams about the importance of sleep for athletes and what we do with other clubs, in Europe, football clubs, soccer clubs,
Mhm.
in Europe. And many of them, approached me and said, we don't have a sleep person in our club, and this seems to be very, very important. Can you maybe help in this way or that way? And what we do is basically we try to personalize sleep treatments for each and every athlete
Wow.
based on their circadian cycle, which is basically the sleep and wake cycle, right? So that's a 24-hour internal cycle that tells you you should go to sleep now, you should be awake now, and we personalize it based on that, and not just tell athletes, well, you're sleeping poorly, you should sleep 7 hours or 9 hours. That's just not gonna work, especially in 2024. And I'm not trying to be, whatever. I'm just telling the hard truth, which
Mhm. Mhm.
is
I think
just
we
the
all need to hear it
practical,
sometimes. Yep.
the
Mhm.
hard truth and the practical truth that some people, just because of their lifestyle, cannot sleep 8 hours every night. And I understand it. Some people, and I can probably finish with this. Some people, my colleagues, just they accept it, but they don't fully understand it. You must sleep 8 hours. Me, on the other hand, I fully understand what it means for you to sleep 6 hours, all the negative consequences. But let's try to get the maximum we can from your crazy lifestyle that you live. And I mean crazy in a positive, dynamic. Some of these footballers, and as well as anyone, I'm here, that lives of elite athletes can, they travel almost every day, some of them, and media, all of that stuff. You just have to adapt the latest sleep science to their
Interesting.
lifestyle, rather than adapting their lifestyle to a fixed idea, 7 to 9 hours. Some people cannot sleep every day 7 to 9 hours. I accept that. So,
Yep. Yep. And I'm glad that you said that, because I think there
yeah,
is some sense of, I know when I'm reading the news and they're telling us that, oh, I know that
no,
recently I read something that said women need more sleep,
yeah,
than men. And they were like, women should be sleeping 10 hours. And I was like, 10 hours? I know that I'm not even getting close to
yeah,
10 hours of sleep. But then I start to feel like, oh shit, like, how do I do this now? And then like,
yeah,
then it all starts with this cycle of like beating yourself up because you're not sleeping enough, you're not doing. So I appreciate that part that you're saying, that like figuring out with each almost individual how
yeah,
to make sure that it like to like increase effectiveness of sleep for them,
yeah,
which I think is great. I
absolutely.
like that.
Absolutely. And I'll just mention, just to be, perfectly clear,
Yes.
of course, people should sleep 7 to 9 hours.
Yes. Yes.
I'm not saying that, but some people, shift workers,
Yeah.
or other people, they just cannot sleep every day for 8 hours. And we need to get the maximum we can for them to have a healthy sleep, however healthy it can be.
Yeah, yeah,
So,
I agree with that. That's great. Something else I had read in
mhm,
your work is that you make connections with sleep to social skills. And I know I see that
mhm,
in the young people I work with,
yeah,
where when they're not sleeping,
yeah,
and it happens a lot in the high school, they're so disconnected from so much, and they're not, with
absolutely.
others and all of that. So I definitely understand there's a connection, but I guess what could you share about that connection? Why
Sure.
particularly like social skills, things like that, could be
Sure.
affected when we're not sleeping enough?
Yeah, sure, sure. I mean, sleep affects every single part of our lives when we sleep poorly. I mean, no one feels good when they sleep poorly, right? When you sleep 4 hours, or even when you sleep 7 hours, but the quality of sleep is bad,
Yep.
no one feels good, tomorrow. And it's just natural and normal. If you don't sleep, or if you sleep poorly, if you don't sleep enough, if you sleep poorly or don't sleep, and or don't sleep enough, to have worse interpersonal relationships. I mean, just a quick example. I feel like all of us anecdotally just felt being more anxious or nervous or explosive, emotional when we sleep poorly, especially several nights in a row. And even small things can trigger us. And then when you sleep normally, right, when you sleep 7 to 9 hours, you just don't notice those things, right? And we all understand that. And another thing is, poor sleep increases, this has been obviously shown, poor sleep increases the levels of stress. And when people are stressed, things can happen, in interpersonal relationships, or things can say, stuff, people can say stuff that they don't really mean. So that's, very, very natural. And that's one of the aspects that's very often neglected, these relationships, interpersonal relationships. I feel like the most common things people say about, poor sleep is hypertension, meaning high blood pressure, diabetes, those types of things. But other everyday things, I feel like, are neglected.
Yeah, that's great. Thank you. Thank you so much for sharing that. So
Yeah,
then it makes me think of how, and I'm curious your opinion on fiaca. Everyone gets
fiaca. Yeah,
fiaca,
yeah.
and I know in Spain they have the siesta hour and all of
They
that
do.
stuff where they really like, encourage almost sort of like, resting or do napping or things like that.
Yeah,
So what's your take on
yeah.
fiaca and napping and all of that?
Yeah, so I'll say it this way. So it's natural in the, let's say, early afternoon hours, 2, 3 p.m., for to have this energy dip. That's
Okay.
natural, normal, proven, all of that stuff. And I'm not saying you should sleep 7 hours in the afternoon. I'm not saying that. And regarding naps, these siestas or fiacas and all of that. So naps are fine as long as
Okay.
you don't nap longer than 30 minutes, more or less. I don't know if it's 27 or 33. It doesn't really matter. But the point is 30 minutes, not an hour, right? Why? Because if people nap for longer than 30 minutes, the likelihood of them getting into deep sleep stages is very high. And when you get into deep sleep stages, it can significantly worsen your sleep the next evening.
Okay.
And then you won't be able to fall asleep at 11 or midnight, but rather at 2. And then you have to wake up for work at 8, and you're going to sleep 6 hours or 5 hours. And that's how, you get into this vicious cycle. And then, of course, you'll feel tired the next day, and then you want to sleep again in the afternoon. And you just have to break this cycle. So that's really, really important. So not longer than more or less 30 minutes. Second important thing about napping is try to do it maximum at like 3:30, 4 p.m.,
Yeah.
not 6, not 8 p.m., because again, highly likely you'll ruin your night sleep, right?
Right.
So use that energy dip that's just normal, 2, 3 p.m., sleep for 30 minutes on the sofa, comfy, in the dark if possible, right? Relaxing. And what people do is, what's known as the caffeine nap, which is very kind of contradictory, I guess. The caffeine nap is very interesting because what people do is people drink coffee right before they fall asleep, and it takes around 30, 40 minutes for caffeine to reach its peak levels in the circulation. So when people wake up after this 30-minute nap, they'll get this additional caffeine boost. So that's in theory, and in practice, some people do feel it. Other people, I will say, it really depends on how quickly or not quickly you metabolize caffeine. Some people who metabolize caffeine extremely quickly might not feel that same boost. Some people who metabolize caffeine very slowly, this caffeine might actually disrupt their sleep, their nap. So those are a few things to consider, and this is where personalized medicine, comes into place. Because what we can do in these people is we can actually measure the metabolizing rate of several enzymes, meaning several exit doors from the body, right? Caffeine goes in the body, then it needs to come out, and it goes out through these enzymes, which need to metabolize that caffeine, and then the body, excretes it via urine and so on and so forth. And we can measure how quickly those enzymes metabolize caffeine. And if they metabolize caffeine very slowly, that caffeine is going to stay in your circulation for a longer period of time. And if it metabolizes it very quickly, it's going to go out very quickly, and you
Interesting.
won't have that longer kind of effect of coffee, of caffeine, of caffeinated drinks. So that's another important
No,
thing
that's
to
a great,
consider
yeah,
still.
that's such a great
Yeah,
point because I think that's a, I mean, you see caffeine consumption and I mean, energy
absolutely.
drinks and things like that consumption and all of that so often for people because they're like, oh, I got to get that quick, sort of fix or whatever, got to wake up, gotta,
Yeah.
and to know that what it does in the body, it takes time, it's all of that. That's great.
And it's important also to say that caffeine on average really depends on the enzymes and other, of course, factors. It takes around 4 to 6 hours to get excreted, 50% of it to get excreted from the body. So not
Mhm.
100%. Meaning if you drink caffeinated drink at 6 p.m., at midnight, you're still likely going to have at least 50% of caffeine in your body. And that's obviously not good for your sleep. So that's
Mhm.
why, drinking late afternoon coffee is not a good idea, or other caffeinated drinks. Tea, several teas, green tea and other teas have also, caffeine or similar, compounds that can promote wakefulness and disrupt sleep. So you have to take notice of those things. Of course, the easiest, quickest kind of solution is no caffeine after 3, 4 p.m., no naps after 3, 4 p.m. Naps should be up to 30 minutes, and that's it.
Great advice. So cool. Really helpful advice.
Yeah.
Now a little bit back to your
Mm-hmm.
career path, your journey.
Sure.
What do you see for yourself maybe moving forward
Sure.
now? What are your hopes, plans? What are you thinking?
Sure. So would love to stay in sleep medicine. I
Okay.
think it's a fascinating, area. Would love to do both clinical and scientific work. I think it's amazing when you can apply, discoveries from science, from academia to actual patients and help people who sleep poorly or mitigate the potential, risks down the road of people who sleep poorly. So that's kind of one aspect. The other kind of, let's say, really professional part, the less professional part, I guess, is I would love to keep on organizing conferences with a great team of people. So it's not me, right? It's a great team of people I have in Croatia, and to basically organize conferences which inspire the next generation of future biomedical leaders. What inspires me is to see them getting inspired. So that's something I would love to continue doing, and we've been doing this since 2017 now. So this is the seventh, I guess, year without COVID. It's going to be like the sixth year or fifth year without COVID. And we've had, a large number of people come to these conferences. So over 23 or 2,400 people attended from Australia to the US and almost every country, in between. Um, and we've had an overall 10 Nobel laureates attend these
Mhm.
conferences. And many of these Nobel laureates and other leaders in medicine, Dean of Harvard Medical School, other people are really, really appreciative of the aspect of the conference, which is connecting them to younger people, to talk to them, to share advice, because these people have been through a lot to get to these amazing, prizes or positions, and now they can share their experience with 25-year-old or a 30-year-old or something like that. And I think that's amazingly valuable for people, especially at that age where I would say that many aren't really sure what they want to do later in life.
Yeah.
So
Yeah.
that's one thing. And probably the other thing is I would love to keep on doing kind of Croatians abroad, I guess,
Yes.
um, um, events or connecting people. I love being, I guess, a facilitator, if you can call that, not
Mhm.
really a blocker. And obviously nobody wants to be a blocker, but I think we all know many people who are, and just kind of helping young people, um, just giving that small boost with I guess the network I have or something else is what really kind of fulfills me and inspires me to do this even more. So
Yeah.
those are, I guess, the three
No,
areas
that's
I want
beautiful.
to do.
And we appreciate that here at Croatians Online, because I think that's
Yeah.
been what our work is really,
Hmm.
to inspire what the diaspora is doing and connect people together and like lift
Yeah.
people up in a lot of ways, promote things that they're doing, because so many people are doing such great things all over the
Amazing.
diaspora. And I
Amazing.
think it's so worth people knowing about it. So I love that you're
Absolutely.
connected to that part within yourself too.
Yeah.
Speaking of young people, what would it be okay if you share
Hmm.
that
Yeah.
in a couple of weeks I'll be there as well?
Sure.
What that event is that I'll be at. There will be some young people
Sure.
coming, so if you could share a little bit about what that is.
Sure. Sure. So quick little background. So I have an organization in Croatia. It's called Medics, like doctors, medics, and it's a nonprofit organization that's composed of 7 or 8 amazing young doctors or young scientists, so all with the range of like 24, 5 to 30 years of age, and all of the people do this voluntarily. And what we do is we organize the conferences I mentioned in Croatia annually, but we also organize that's connected to the event, which is we partner with research labs or clinics from leading biomedical institutions in the US and around the world now. So, Harvard, MIT, Cleveland Clinic, those types of institutions, King's College London. And we partner with research labs or clinics there, and we offer top Croatian medical students and next year physicians and young scientists, so PhD students and postdocs, an opportunity to visit these institutions for 1 to 3 months, learn as much as possible, do an internship, do an observership, because it's not every day that you can just, oh, I want to go to Mayo Clinic, the
Uh-huh.
best hospital in the world. And we want to offer these students those opportunities. And then the idea, the kind of the overarching story that might not be as evident as this is, we want these people to come back to Croatia, implement all of the stuff, or at least some of the stuff they saw, the organizational skills, patient care, patient communication, thinking about research, all of that stuff that doesn't require a lot or any money. Right. I understand that obviously we can't build a Mayo Clinic in Split because of money and many other things, but we can try to slowly implement the mentality that people at Mayo or Harvard have in Croatia. So that's kind of the override. It's basically an investment, a 10-20 year investment in like Croatian biomedical community, and hopefully it's going to pay off in 20 years. And the event that you mentioned is, we have 8 students visiting the US, so various institutions I mentioned, and all of them are coming to Boston in 2 weeks, I guess. And what we want to do is, we obviously want to show them Harvard and all that stuff, but we want them to meet other young people here in Boston from the biomedical community, especially of Croatian descent or are Croatians now, and senior Croatians here in Boston in the biomedical community, to network, meet, and potentially explore collaborations or other opportunities. It's a small networking event, 20-ish people more or less, but I think I just feel like it's the right thing to do, to offer these people the best possible resources you can, because I do think that one of the biggest investments a country can make, or an education system can make, is investment in young people. It's great to have buildings, new buildings, shiny buildings, that's all great, but if you don't invest in the people, in shaping their mindset for when they become doctors, physicians, all of that stuff, scientists, I think you're just kind of wasting resources, to be honest. So
Yeah. No, that's amazing.
yeah.
And I what I hear in that, which I really like, and that's another thing that I
Hmm.
think stands out a lot for me as someone who's working with Croatians Online, and also
Yeah.
feels like I have my foot in America and in Croatia a lot of the time, is that
Yeah.
your heart is in not only the work here in the USA, but also you're keeping connected to that Croatian culture
Oh
and
yeah.
things that are happening over there too, and you're able to find room for it all, which is really special when
Yeah.
we see that.
I feel like it's almost an unwritten rule, and it is probably an unwritten rule that, you must never forget where you came from. I came from a very average family. Split is not London, New York, or
Mm,
Boston in terms of medicine. I said great heart, great passion, but it's not in terms of medicine a major hub. And I really never forgot where I came from those very humble kind of beginnings, and I want to be the person, of course, along with other people who are going to help young people who were, I was, their age, 10 years ago, and I knew what type of, position I was in. I wasn't split. I didn't know anything about Harvard or MIT or anything. I knew about them, but that's more or less it. I didn't have a vision back
mhm,
then that I was, I want to be, the sleep scientist at a leading institution. I want to try to help these young people explore while they can, because I feel like at a younger age it's much easier than when you're potentially married or um, later on in life, to see these institutions, to explore the American culture. I think America has so much to offer. I mean, I'm not the first person saying this, of course, especially in the field of biomedicine. Just for, I mean, we had students here at Harvard. They were in the lab I work with, and they were with me, and their eyes just kind of opened after only a month, because they're all of these people, or basically all of these people, are amazing, not only students in terms of they get all A's, but these, you can see that these people have the potential to be the leaders in their field, and I just want to give them a tiny boost. Go and see Mayo, go and see Harvard, go and see MIT, network, and get that boost.
that's
And that's
amazing.
what I want to do.
That's really
So
wonderful. And I think that that's something that will that work that you're doing, that you're hoping to kind
yeah.
of continue in some ways and spread, that's how it's happening. So that's such an amazing thing that you're doing, and we
Yeah.
really
And and
appreciate
and,
that.
and I will say, as sorry for
Yeah, no,
interrupting. I
go
mean,
ahead.
uh, it's only us two in this call, but not behind me, but next to me are tens of people, young
Really.
people who are incredible,
Yes.
dedicating their time for $0 or kuna or
Yes.
euros or whatever,
Euros
zero
now, right?
dollars, euros now, exactly. And dedicating their time, their passion to this. They could be doing loads of other things. They could be doing nothing, right? But
Yeah.
they're taking that time and dedicating to this. So, I'm deeply appreciative of every one of those
That's
people. So,
amazing. That's amazing. Okay, so then my final question for you is more of a
sure.
fun one. I like to ask this of
Hmm.
everyone that I interview. It's, what is your favorite thing about Croatian culture? And that could be anything. What comes to your
Yeah.
mind?
It's probably the never give up mentality.
Right. Mm-hmm.
And I think you can see it in sports. I mean, so clearly. We're obviously we're a small country. I mean, on the background you can see many
Yes.
continents, but it's a
Mm-hmm.
tiny kind of speck there. But I think it's a speck full of amazing people who just are not give uppers. Okay, they're gonna work, they're gonna not give up, and they're gonna win in the end. And I just want for those people to have, this is maybe philosophical, maybe not even within the realm of my kind of possibilities or work now, and that is, I want those people, them being 1 years of age or 99 years of age or 100, right? I just want them to have a 5% better life, 10% better life in terms of financials, in terms of bureaucracy, all of that stuff. And I'm just doing my part within the biomedical field, which I can help. Obviously, I'm not great in physics or other fields, but I'm sure there are other people who can make a big difference in other fields as well. But it is the never give up mentality, and I guess I have that mentality
Yeah.
of not giving up.
That's
Probably I could have
amazing.
given up at various
But you
stages, but
didn't. Yeah. Yeah. Mm-hmm.
and now I'm talking to you here, so
That's amazing. And I think that I like that too. And I'm so glad that you said that, because I never put it in that context, but I think that that's
yeah,
such a great way to put the culture of people, is that we don't give up. We look
yeah,
for to keep pushing ourselves. I mean, you mentioned it, the athletes, the Olympics now, to see such a small
yeah,
country, getting medals and doing all these things. It shows
amazing,
a lot of that
amazing.
effort that everyone really puts into what they
And
do, and
yeah,
it is great.
and I assume so. I don't know obviously many sports. I know football,
Hmm.
basketball, but I assume that in many other sports, the infrastructure in Croatia is not the best, maybe
Yep.
for some
Yep.
people coming from smaller cities or smaller towns, basically training maybe in high school gyms or whatever. And now they're going to the biggest, sports scene in the world, winning medals. It's just incredible.
Amazing. It
It is
really is
incredible.
incredible. Wonderful. Thank you so much, Dr. Yuginovic, for being with us today. Could
Thanks, Sarah.
you let us
Mhm.
know how listeners can continue to like follow your work? Do you have an
Sure.
Instagram? What's your website? Anything that you think people could follow
Sure.
you on?
As people say, if you're not on Instagram, you're nowhere,
Yes.
right?
Yes.
So so
So true.
so yeah, I mean, people can always reach out via email, and I'm sure they can just Google Alen Juginovic, and
Yep.
then email. I'm sure will pop up, LinkedIn, Instagram, the usual kind of suspects, I guess. But I'm always more than happy to help anyone I can, especially in the biomedical field, but really anyone I can in any aspect I can, as long as I have the 5 minutes or 10 minutes or however much time necessary. But I'll give my best. So
Wonderful. Thank you so much. We look forward to hearing everything that you're going to do in the future. And we'll love to hear about it here at Croatians Online. So thank you for joining us so much
yes,
today.
thank you so much, Sarah. It's been great.
Thanks.